Thanks, Dave, and thanks again for everyone that's joined. I had a chat with Dave and Ty just sort of around this concept of a connected care record. And as Dave rightly identifies, there's really a lot of ways that that information can be used to help the way we operate. But I thought unplanned weight loss was really quite a useful example of why a connected care record can matter. So certainly most people will be tracking weight and certainly our residential partners will be tracking it as a quality indicator. But that kind of information doesn't necessarily tell us why someone's losing weight. And so I think weight's quite unique in that the mechanisms can be quite diverse and that information can live in lots of different places. And so for one person, it could be a broader part of clinical deterioration or end of life. For another person, it may be related to grief, depression, declining quality of life affecting their appetite. For another, it could be oral pain, poorly fitting dentures, or another oral health issue that's been missed. It could be dysphagia leading to dissatisfaction with food or a change in the overall mealtime experience. And so when you start to think about those diversity of reasons, it becomes really apparent that the clues will sit in very different places. And so obviously, things like care records and clinical assessments, the quality indicators themselves, but also catering information and food wastage. It could be in resident experience and quality of life surveys. It could be feedback and complaints from the resident or families. So no single source of truth necessarily gives us the answer. And so very clearly the value of the connected care record is not just about having more data. It's bringing together the right information so we can understand what's actually driving the outcome for a particular person. And that's an example of, really at the individual level and sort of unpacking that story. But we've got some other examples I'll speak to a little bit later on where we're sort of using the data in more of an aggregate example.